Do you have questions you're afraid to ask your doctor? Let's go over some of these questions and show you how you can ask your doctor those questions. Why do some people get UTI frequently? Let's define what that really means. If you're having more than 2 episodes of urinary tract infection a year, then that's considered frequent. And there are several reasons for this. Some of this could be due to genetics, some could be due to immune suppression or immune deficiency, or something like having diabetes that's not controlled put you at risk for diabetes. Women tend to have shorter urethra, so that puts them more at risk. Some women do get frequent infection after sex because they are not washing after sex. Sometimes they're wiping front to back, or from back to front. That could be a risk. Sometimes not going to the bathroom very frequently, holding your urine for a long period of time. So there's really a lot of reasons why people can have frequent urinary tract infection. Sometimes kidney stones. If you have kidney stones that cause an obstruction, that can also lead to frequent infection. Some people have reflux, where urine kind of backflow into the kidneys that can put you for a risk of infection. So there's so many reasons why people can have frequent urinary tract infection. People who are in menopause, people who have multiple childbirth, who now have a prolapse of the uterus, that can also put them at risk, or bladder prolapse. So there's so many reasons why it could be. Someone has a stroke. Now the bladder is not functioning like it used to. It doesn't contract and empty the bladder completely. Or you have enlarged prostate for a guy that's causing obstruction of bladder, so it doesn't empty completely. When you have frequent urinary tract infection, you want to speak to your doctor to make sure they do all the necessary workup to see why or what's causing your frequency of infection. Asking your doctor about an STD testing should not be awkward. Sometimes your doctor feels awkward asking you, or your doctor might not think you are at risk for sexually transmitted disease. You should feel comfortable asking your doctor for this test. In fact, I encourage you to ask your doctor for this. There are several ways you can ask the question. You can say, so I would like to be tested or screened every 6 months or yearly for sexually transmitted disease, just like my other tests, because I just want to know. It doesn't mean that you're promiscuous by any means. You just want to say, I just want to be a part of my routine testing. If you say that, your doctor will be glad to do that. And if your doctor tells you, oh, you don't need it because you're not at risk, then maybe you need to change doctor, because you should be able to request this test and get it done. Can birth control mess or affect your mental health? Well, think about it for a second. Birth control pills are basically hormones, synthetic hormones, estrogen and progesterone, and that can alter your physiology. Most people start taking this when they're adolescent, and so when you start affecting normal physiology, that can affect your mood, your response to stress, and this can actually cause depression or anxiety in some people. And so when you do take birth control pills, you need to monitor how you feel, you need to monitor your response to stress, you need to monitor whether you're becoming more anxious, and discuss it with your doctor, because it certainly can affect the way you feel. It can lead to more depression in some people, and other folks, it might not cause that much of a change in how they feel. But do not feel ashamed or terrible if you feel something is different. Once you start taking these hormones, you should always have that discussion with your doctor and express how you feel. Maybe this is not for you. Maybe they need to change to a different form of birth control pills. So yes, it can affect how you feel, but not in everyone. Is it normal to lose sex drive when you're stressed or when you're taking medications? That's true. For example, for older patients who are taking blood pressure medication, that can definitely affect their sex drive in some scenarios. Not all blood pressures will do this, but some will, especially the ones that causes more what we call vasodilation. Stress can also affect your sex drive, because sexual activity is linked to brain activity, how you feel, your emotion. So when you're stressed, it definitely can affect your response to sexual activity, your desire to be engaged in sexual activity. So absolutely, stress and medication can affect your sex drive. Well, if you don't want to take the medication your doctor prescribed, this is actually very common. I've seen patients come to me and I see their blood pressure is high, and I go, well, your blood pressure is high, you taking your medication? And they go, well, I'm not taking it because I'm having side effects. It's causing me diarrhea, or it's making me dizzy. And I'll go, did you talk to your doctor about it? Oh, well, I didn't say anything. Or they go, well, I told them, but they just didn't do anything. Well, here's the problem. If you don't tell your doctor and you go see your doctor again and they go, oh, this medications aren't working, then they tend to increase the dose or add more drugs to it, which may not be what you need. So having an open conversation with your doctor and telling them what you're feeling from your medication, and you can both come to an understanding that this may not be the right drug for you. That way you can both decide on choosing a different drug that you may benefit from that will not cause you side effects. If you do not like the medication because it's making you feel bad, always let your doctor know so you can both come up with something different. You can always ask for more lab tests even if your doctor says you're fine, because most doctors, all of us actually, normally will run what we call a standard test, kind of commonly done for our patients. But there are some situations where we need additional testing. However, you don't want to be running too many tests that you don't really need. So if you feel that you need additional testing, have a conversation with your doctor. If your doctor thinks it's appropriate, they will run those additional testing. But if your doctor thinks it's not an appropriate test, then they can tell you why it's not an appropriate test. Remember, just running a bunch of tests is not necessarily in your best interest, because there are what we call false positive tests and false negative tests, meaning that if you run a test in a population that's not likely to have a disease, if that test comes back positive, all you're going to be left with is worrying about something that you may not have. Doing a test is great, but don't do a test that you don't really need. So having a conversation with your doctor to an understanding of whether what test you want is appropriate or not. How do you know if your doctor is just brushing you off? I think with any interaction with someone, whether it be your lawyer, your doctor, you should always feel comfortable with that individual. You should always feel comfortable you can have a conversation and have a dialogue. If you don't feel like you can talk to your doctor, or you don't feel like you've been listened to, then you may want to get a second opinion to see if your doctor is brushing you off. If you get a second opinion and you hear the same story or the same answer, then maybe they're not brushing you off. But you have every right to seek a second opinion if you don't feel comfortable with what your doctor is saying, or you don't feel like they're listening to you. Maybe you're not understanding what they're telling you, or maybe they're just brushing you off. The only way to find out is seek second opinion if you don't feel comfortable about it. Is it okay to cry in a medical appointment? Well, I think that you should always let your emotions out. Be yourself. So if you're talking to your doctor and maybe something that came about, maybe you're feeling depressed, express yourself. Be who you are. If the conversation is making you sad and you want to cry, then cry. There's nothing wrong, so we can truly understand what's going on within you. If you want more answers to other questions, you may be afraid to ask your doctor. Stay tuned. We'll discuss more of those questions.